Young and healthy people admitted to hospital with coronavirus are leaving with serious long-term problems. A study, even the youngest patients with few underlying health problems were suffering kidney damage, according to findings presented. The research found nearly half of adults across all age groups admitted to hospital with the virus have experienced at least one health-related complication. 1 in 4 COVID-19 survivors were having trouble coping at home after discharge, the research suggested. The study highlighted how even the youngest and healthiest patients were being discharged with serious or the research paper contains a direct warning to the UK government to plan for the potential for long-term population health and economic problems after the pandemic. Are you a young and previously healthy COVID survivor now suffering long-term problems? Email webnews@nico.uk. The researchers urged officials to consider public health messaging alongside the vaccine rollout, alerting young people of the long-term risk posed to their health by the virus. Fit and healthy young people have globally been the least worst-hit demographic, as the elderly and clinically vulnerable died at the highest rate. Young people have been thought more likely to be asymptomatic spreaders of the virus, with a lower risk of severe illness. But the emergence of so-called long COVID, characterized by a vast array of long-term health effects including post-viral fatigue, have led to concerns its effects on the young have been underplayed. The latest findings, which involved more than 73,000 patients across 302 healthcare facilities in the UK between January 17 and August 4, 2020, were presented to government scientific advisory group SAGE on February 4. The contents of the findings were a stark warning against pursuit of a herd immunity strategy favored by some lockdown critics. The researchers found complications were most common in males, those aged 30 and over, and in patients with underlying health conditions, the scientists said in the document published on while patients under the age of 50 years were at lower risk of mortality. The researcher found high rates of complications across all. The overall mortality rate was 31.5%, 23,092, and nearly half of the participants, 49.7%, experienced at least one health complication, such as heart, kidney or respiratory problems. The findings showed 1 in 4 of those with complications had difficulties coping at home after discharge. Unfavorable outcomes were most commonly observed in the kidneys, 24.3%, respiratory systems, 4%, as well as the entire body, 16.3%, cardiovascular, 12.3%, neurological, 3%, and gastrointestinal, 10.8%. Complications were also reported. The impacts of some of the complications were worse depending on age, and the study said liver injury was most frequently seen in younger age groups under 60 years old, with the highest rates occurring in men. Black patients had a significantly higher rate of acute kidney injury. Obese patients 6 times more likely to have respiratory complications and 1.3 times more likely to have renal complications. Complications were higher in men than in women, including among younger men with no underlying health problems, the study found. Although men were more likely to experience complications at younger ages, men over 60 were most likely to experience a complication. About 28.4% of men aged 19 to 29 with no underlying health problems and 16.6% of women in the same category suffered from complications after being hospitalized with the virus, the researchers found. It concluded that the findings suggested that although young people are less likely to die, they may be proportionally more likely to survive and live with complications. Peter Openshaw, professor of experimental medicine at Imperial College London and one of the co-authors on the ASARIC study, said, most planning with respect to COVID has focused on mortality, for example in setting the priority groups for vaccination. The ASARIC 4C study is the largest of its kind in the world, systematically collecting data on the features of those admitted to hospital with COVID-19 in the UK. We now show that there are other severe outcomes that need to be taken into account in estimating the impact of COVID-19. Long-term complications are especially common in males, those aged 30 and over, and in patients with comorbid renal problems are seen in about a quarter of all cases, but respiratory, cardiovascular, neurological and hepatic complications are also significant. He added, about 1 in 4 of those with complications have trouble coping at home after discharge. The severe outcomes we now describe are seen even in younger age groups and those with few pre-existing risk factors. The persistent effects of severe COVID that we identify need to be factored in when planning preventive and therapeutic interventions, including vaccine priority. Further studies are needed to understand how these adverse outcomes arise and how they can be prevented and treated.